Lieutenant General Ritterman. Now, the government announced this week a new task force to try and speed up the development and production of a coronavirus vaccine. And many people believe that a vaccine is really the safest long-term route out of the lockdown. But how long could one take to develop? One of the people who might be able to tell us is Sir Jeremy Farrar, the director of the Wellcome Trust, one of the experts who's been advising the government. Thank you so much for being on the programme. You are involved in the search for a vaccine. How optimistic are you that we'll find one, and how long could that take?
I'm optimistic. Science has moved on in enormous ways over the last few years, and the ability to do the science, do the research, do the development and the manufacturing is incomparable to what it was even, say, 10 years ago. But the truth is we don't have another vaccine for any other human coronavirus, common cold, SARS, MERS, and so it's not a given that we will make a vaccine. I would be optimistic. But it's not whether it's a vaccine or a treatment or a test or a diagnostics. The truth is we have to do all of these, and we have to do all of them in parallel, because we're not sure which one of these will work. And in the end, actually, we need all of those. And so the investment now in the science, the research, the development, but also making sure now that we're thinking about how do we manufacture it? Because if we did have a vaccine, let's say, late in 2020 or into 2021, we would then need to manufacture it in billions of doses and make those billions of doses available to the world. So just having a vaccine that is safe and effective, proven, is not enough. We have to think all the way through to the end of how we get this around the world, because if there is any country vulnerable, if there is any country where there is still transmission of this virus, then in fact, every country is vulnerable. And so it needs all of us to come together, from industry, from governments, from philanthropy, from science, to come together to make sure this can be done, and done as quickly as we possibly can, which I hope we would have a vaccine towards the end of this year. But that's a vaccine in a vial. It's a vaccine that we believe to be safe, a vaccine that we think might be effective. That's not having a vaccine for the world.
Interesting. So you hope that there could be one by the end of this year. Scientists at Oxford University say they're hoping to have 1 million doses of a vaccine by September. I mean, that does seem to be on a slightly different time frame to many other people I've spoken to who say, a vaccine could be 18 months away. Do you think that's realistic?
I think it's realistic that we will have vaccines, that we have been into people already. On the beginning of May. The first vaccine in America was administered to somebody, a healthy volunteer, to see if it was safe. So we have a vaccine in a sense now. We don't know if it's effective. We don't know how safe it is. And it's not manufactured at any scale. That does take time to prove both safety, and it's critical. Vaccines are given to healthy people. We must make sure they are safe, and we must make sure they're effective and they would protect somebody from being infected. So I think it's just crucial to realize having a vaccine in itself, in, say, 1 million doses, which you know to be safe and you believe to be effective, that is not the end game. The end game is making sure that it is truly effective. It's effective in the elderly, it's effective in young children, it's effective right across the age group, in all populations. And then you have to manufacture that in billions of doses to administer them to the world. And then you actually have to get that vaccine to people wherever they are, leaving nobody behind. That is an enormous scientific challenge. It's also an enormous logistics and delivery challenge.
I just want to pick up on something you said in your first answer, which is that it's not given that we might even be able to get a vaccine for COVID-19. The World Health Organization has said there's currently no evidence that people who've recovered from coronavirus have immunity. And we've also seen, of course, those cases in South Korea where people have seemingly recovered from COVID-19 and then test positive again. Are you worried that we might not get immunity?
Yeah, I'm worried on so many levels. This is a completely new infection. Prior to some point in December, humanity had never seen this virus before. So we're learning all about it all of the time. Do people, when they recover from the infection, do they develop immunity? Does that protect them against getting a second infection? How long does that immunity last? Is the immunity the same in children as in adults? Is it the same in senior individuals? We're learning all of this all of the time. What is clear, though, is that after you are infected, the majority of people actually do make what we call antibodies, which we believe are really important for infection. Most people, by about a month after infection, do have antibodies, which we think would be important in protecting them against the future. If that's true, then the possibility of making a vaccine, I would be more optimistic, yes. How long it will last? Does it last 1 year, 3 years? Do we have to revaccinate after a period of time? Those are all things which science just can't tell us at the moment, but are absolutely critical questions.
What does it mean as well for antibody tests? I mean, many people saw this as a potential way out of a lockdown, but if the whole of immunity or how long immunity lasts for is under question, is that idea now really for the birds?
No, it's not for the birds. The antibody tests done through a laboratory, by a laboratory test called an ELISA, those, I believe, are now increasingly robust. They can be trusted to be sure you're identifying somebody that has been infected, and you can be sure that somebody who does not have antibodies has not been protected at about a month or thereafter. We must learn how long those antibodies last. Do they last 3 months? Do they last 6 months? Are they still there 5 years later? And of course, at the moment, only 4 months into this pandemic, we don't know the answers to those questions. The rapid diagnostic tests, which have been talked about a lot, in my view, none of those rapid diagnostic tests today are good enough to be used to inform individuals about their risks or whether they've got antibodies, whether they can go back to work. Those rapid tests are just not good enough at the moment to be able to inform individual decisions, and they're not really good enough to tell us the amount of antibodies in the population at large. So we are reliant on the test for the virus done by a PCR, that's for a virus, and we're reliant on a test in a laboratory called an ELISA to measure those antibodies.
OK, now a really tragically high number of people are still, of course, dying of COVID-19, but there is some evidence that the number is stabilising, even that the number of people in critical care in hospital beds is even starting to come down. Do you believe we may be past the peak?
Yes, of this first wave, we should not see this as a discrete episode. I think the probabilities, what we must be planning for, is that there would be further waves of this in the future. But for this first wave, I think the number of new infections stabilised maybe a week or two ago, the number of hospitalizations maybe a week or so ago. And yes, tragically, there are still far too many people dying, but the number of people dying in this country, and actually in many countries of the world, is now either stabilising or starting to come down. That is good news. We're probably just past the peak in many parts of this country, as is true in many parts of the world. And we will come off that peak and the numbers will reduce. But that has only happened because of the public's respect for and following of the advice around the social distancing and the lockdowns. If we were to release those lockdowns too soon, whilst the infection rates are still high and there are still people in the community who have got infected, then the epidemic would come back again. It would come back very quickly. It would rebound within a few weeks or a couple of months. And so it's critical that the public is really respecting the advice. And it is that has driven the change in numbers. These things don't happen by chance. They happen because what we're all doing. And the public deserve great thanks and respect for that. It has made a huge difference.
So with all that in mind, when do you think some of the lockdown measures could start to be eased? We've seen lots of reports, for example, suggesting that it could be as early as mid-May.
Yeah, it really depends on the data. It's impossible today to give a date, in fact. What is most important is that you see from data, not just plucking figures from the sky, you see data that suggests the number of infections are now below a certain level, the number of people in hospital below a certain level, healthcare workers are protected, and we know that the NHS has got the capacity to deal with any rebound if it came. Critically, though, the circulation in the community, the circulation in care homes that was on earlier on your programme, and of course the circulation that is going on still in hospitals, those all have to come down dramatically, further than they are today. I would hope that they will get there in 3-4 weeks' time, because it's clear that the lockdown can't go on for much longer. The damage it's doing to all of our health, our well-being, our mental health, it's disproportionately, of course, affecting the most vulnerable and the least able to, with resilience in society. That's a really big issue of inequality. The lockdown is damaging business, and ultimately that's damaging all of our lives. So the lockdowns cannot go on forever. We must lift them as soon as we can, but we can't lift them too soon. And we can't just make arbitrary dates and say it'll be a date in May that is plucked from the sky now. It has to be driven, I'm afraid, by the data, and the data will come clear over the next 1, 2, and 3 weeks. And a huge amount of effort is going on to make sure that data is available.
OK, now I spoke to Michael Gove a little bit earlier on the programme and was talking about the UK government's response. I put it to him that on things such as testing, on protective equipment, the government seems to have been slower than other countries in gearing up. Of course, hindsight is a wonderful thing, but do you think that the UK has been a bit flat-footed in responding to COVID-19, particularly when you compare it to other countries, perhaps with more experience of dealing with these kind of respiratory pandemics?
Yeah, I think there must be lessons learned, and there must be lessons learned, of course, in comparison to other countries. Your point at the end there about experience of epidemics and pandemics, I think, is a really important one. I think Korea has done an amazing job so far, but let us just wait until see the whole pandemic pass through. But Korea has at the moment done a fantastic job, as has Singapore. And both of those countries in the last few years did suffer from really quite devastating epidemics. Singapore suffered very badly from SARS in 2002, 2003. Korea had a very nasty outbreak of Middle East respiratory syndrome, MERS, just a few years ago, when one person flew into Seoul and infected about 200 other people, including in hospital and clinic environments. So they reformed their public health system. They put in place measures that would allow them to respond much quicker. And I think you're now seeing the benefits of that preparation. It all comes back in the end to investment in public health. Public health is something you often don't see. It prevents things rather than reacting to them. It keeps us all healthy without us really ever giving the credit it deserves. And what you see if you don't invest in public health, and frankly, most countries around the world do not invest in public health enough, then you see when you're stretched, when you're stressed, when epidemics come and that the unexpected happens, there is not that spare capacity in order to respond in ways that Singapore and Korea, after the epidemics they suffered in recent years, were able to reinvest in those. And in the end, that's what counts.
The Sunday Times this morning claims there were 5 lost weeks at the beginning of the year when Boris Johnson wasn't attending every COBRA meeting, when the UK wasn't listening to the warnings from scientists and looking to what was happening elsewhere and trying to ramp up testing capacity, trying to bring in protective equipment. Were we too slow in those early months?
Yeah, these lessons will be learned. I think that in relation to testing, yes, if you look at what was happening in Korea and Singapore and indeed in Germany, there was a much quicker ramping up of testing. Testing is critical. Testing will be critical as we come out of this epidemic. Testing and isolation, as advised by the WHO, is actually at the heart of every public health response. Testing, isolation, looking after the vulnerable, making sure you've got clinical capacity to look after those that inevitably do get sick, as well as the development of diagnostics, treatment, and vaccines. But the ramping up of testing, the provision of PPE in hospitals to protect healthcare workers, all of these, in retrospect, yes, should have happened earlier. I've worked in emerging infections for 20 years now, living in Vietnam. And the key is you've got to move faster than the pace of the epidemic. You can't be complacent. You cannot think that we're doing well because we're going faster than we usually do. If that is slower than the pace of the epidemic itself, you will fall behind. And when the epidemic is going at its fastest, falling behind, you never actually catch up, or you don't catch up for many weeks. And I think that, for me, is the lesson that must be learned. You have to go faster than the epidemic itself, not just pretend that you're going quicker than you usually do. It's all dependent on the epidemic threat that you face, not some arbitrary other situation.
Thank you. It's really fascinating to hear from you this morning. Much appreciated.
Pleasure.
So, Jeremy.